A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant move that has captured the attention of the nation, President Donald Trump announced on Monday that he has selected Dr. Susan Monarez to serve as the permanent director of the Centers for Disease Control and Prevention, CDC. This decision marks a historic shift, as Dr. Monarez would become the first non-physician to lead the agency in more than half a century. The nomination comes on the heels of Trump's withdrawal of his previous nominee, Dr. Dave Weldon, just hours before his confirmation hearing due to a lack of Senate support. Dr. Monarez, who has been serving as the acting director since shortly after Trump took office in January, is an infectious disease researcher with a PhD in microbiology and immunology. She has held various roles within the U.S. government, including Deputy Director of the Advanced Research Projects Agency for Health ARPH, where she led initiatives in health technology and artificial intelligence. Trump's announcement was made via his Truth Social platform, where he emphasized the need for a leader who can restore confidence in the CDC, which he claims has been marred by political bias and mismanagement. He stated, "Americans have lost confidence in the CDC due to political bias and disastrous mismanagement," and expressed his belief that Dr. Monarez would work alongside Health Secretary Robert F. Kennedy Jr. to tackle the chronic disease epidemic and enhance the agency's accountability. Dr. Monarez's nomination is particularly noteworthy as she will require Senate confirmation, a change mandated by a law passed in 2022 that now necessitates Senate approval for CDC directors. This contrasts with previous directors who could assume their roles immediately upon presidential appointment. Trump's choice of Monarez has raised eyebrows, as past interim directors typically hailed from within the CDC's ranks. Nevertheless, Monarez's extensive government experience, which spans both Republican and Democratic administrations, has positioned her as a frontrunner for the role. During her time as acting director, Monarez has faced scrutiny over several contentious decisions, including the independence of the CDC's medical research publications and delays in convening vaccine advisory meetings. Additionally, her involvement in proposed workforce reductions at the CDC, potentially impacting up to 30% of staff, is expected to be a focal point during her confirmation hearings. As the nation grapples with ongoing public health challenges, the confirmation process for Dr. Monarez promises to be a pivotal moment for the CDC and its future direction. Her nomination reflects the Trump administration's commitment to innovation and transparency in public health, as highlighted by the president's remarks regarding her qualifications. Monarez's background, while unconventional for a CDC director, may bring a fresh perspective to an agency that has been under intense scrutiny in recent years. As the Senate prepares to review her nomination, the implications of her leadership on the CDC's role in managing public health crises will be closely watched by both supporters and critics alike. In a political landscape marked by division and debate over health policies, Dr. Monarez's appointment could signal a new chapter for the CDC as it seeks to regain public trust and effectively respond to the health needs of the American populace. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.